Anxiety. We all know the feeling: butterflies in your stomach before a big presentation, restlessness before a first date. These feelings are a normal part of life, but when worry and fear become overwhelming, they can interfere with daily life. This is anxiety at a clinical level, and it affects millions. Anxiety is more than just feeling stressed or worried. It's a complex mental health condition that can manifest in many ways. From persistent worry to physical symptoms like a racing heart and difficulty sleeping, anxiety can be debilitating. It impacts our thoughts, our behaviors, and our relationships. It's important to remember that anxiety is not a sign of weakness. It's a medical condition, just like any other. And just like any other medical condition, it can be treated. The first step is understanding what anxiety is and how common it truly is. The numbers are startling. Anxiety is the most common mental illness in the UK. In the past 2 weeks alone, 60% of UK adults experienced anxiety that disrupted their daily routines. That's 3 out of every 5 people you see on the street. Imagine a football stadium packed with fans. Now imagine that over half of those fans are struggling with anxiety. That's the reality of how widespread this issue is. And these are just the reported cases. Many individuals suffer in silence, afraid to speak out due to the stigma surrounding mental health. The pervasiveness of anxiety paints a clear picture. This is not a niche issue, but a societal concern. We need to start talking about anxiety openly and honestly. We need to create an environment where people feel safe seeking help without fear of judgment. Anxiety doesn't discriminate. It affects people of all ages, genders, and backgrounds. However, certain groups are disproportionately affected. For example, women are more likely to experience anxiety than men. This could be due to a number of factors, including hormonal fluctuations and societal pressures. Young people are also particularly vulnerable. In fact, 67% of young employees aged 16 to 24 report experiencing anxiety. The pressure to succeed in a competitive job market, coupled with social media comparisons and financial instability, creates a perfect storm for anxiety to thrive. Furthermore, LGBTQIA+ individuals are more likely to experience anxiety than their heterosexual counterparts. This is often linked to discrimination, prejudice, and the stress of concealing their true identity. It's crucial to acknowledge these disparities and ensure that everyone has access to appropriate mental health support. Section 4. Anxiety at Work, a Silent Epidemic. The workplace can be a breeding ground for anxiety. Deadlines, performance reviews, and office politics can take a toll on our mental well-being. It's no surprise that 60% of employees report experiencing anxiety. This has a ripple effect, impacting not only individual well-being, but also productivity and the economy as a whole. The cost of workplace anxiety is staggering. In the UK alone, 13.7 million working days are lost each year due to work-related stress, anxiety, and depression. This equates to a financial loss of £28.3 billion annually. These figures highlight the urgent need for employers to prioritise mental health in the workplace. Creating a supportive work environment, promoting work-life balance, and providing access to mental health resources are crucial steps in tackling this issue. Ignoring the problem is not an option. It's time for businesses to invest in the well-being of their employees for the benefit of everyone. Section 5. Breaking the Stigma. Seeking help and encouraging support. The stigma surrounding anxiety prevents many from seeking the help they need. We need to shatter the silence and create a culture where talking about mental health is not taboo, but encouraged. Just like we wouldn't hesitate to seek help for a physical ailment, we should feel equally comfortable seeking help for our mental well-being. There are many effective treatments for anxiety, including therapy, medication, and lifestyle changes. The key is to find what works best for you. Remember, you don't have to suffer in silence. Reach out to a trusted friend, family member, or healthcare professional. If you know someone who is struggling with anxiety, be supportive and understanding. Listen without judgment, offer practical help, and encourage them to seek professional help if needed. Small acts of kindness can make a world of difference. Together, we can break the stigma and create a world where everyone feels supported and empowered to prioritize their mental health.